This is everything you need to know about Aspergillus. First of all, septate branching at what degree? 45. Can it invade blood vessels? Yes. What does that cause? Necrosis. And these are dichotomous acute angles, unlike mucor. These are also going to be fungus balls. And why is that important? Well, we got lungs here. There's a chest cavity, we have lungs, upper cavity problem. Person's got tuberculosis. These form in pre-existing lung cavities. There's 3. 4, remember angio invasion. So that's seen in immunocompromised patients causing hemorrhagic infarcts in the lungs and the brain. You can also know that it's associated with chronic granulomatous disease. Neutrophils can't form your ROS, and so Aspergillus overgrows. It's also associated with leukemia and chemotherapy. Again, it's your neutropenia, and so you have an invasive risk. We talked about this, but asthmatics and those with cystic fibrosis are more prone to a BPA from chronic airway inflammation. And so the patho is that you got a spore, you inhale it, and in healthy people, this is going to be cleared no problem by your alveolar macrophages. But if you're immunocompromised or you have structurally abnormal lungs, you have a hyphal invasion of the tissue, and that invasion causes thrombosis, necrosis, hemorrhagic infarcts, and you have an exaggerated immune response that damages your bronchioles. So look out for IgE, eosinophilia, central bronchiectasis, and the ABPA. You can pause and look at this if you want. The fungus that moved in, buzzwords, old TB cavity, associations, prior TB, hemoptysis, cavity. And here's our practice question. Got a man, healed histo, undergoes imaging. Now you have a spherical mass in a thin-walled cavity of right upper lobe. What's the diagnosis? Aspergillus. We got our fungal ball. That's the reason why. Invasive requires immunocompromise. Lung abscess would be air fluid level system toxicity. Squamous is a spiculated mass, not round. And historeactivation would be fever, malaise, and new consolidations. So if you see a pre-existing lung cavity, round mass that moves with gravity, typically asymptomatic, but you have potential for hemoptysis and a crescent sign, you should be thinking Aspergilloma. I just want to make sure you guys get the most high yield content, so like and subscribe if you're into that. See you in the next one.